Elizabeth Vogel.
Yeah.
Hi, I'm Katie. I'm going to be working with the radiologist on your exam today. If you could come back to the room with me and have a seat. Okay, can you tell me your name and date of birth?
Elizabeth Vogel, 7/22/05.
All right, can I see your wristband? Okay, that's you. Before we begin, is there any chance that you're pregnant? No. Okay. All right, and we're doing a barium enema today. Is this correct? Okay. So there were some dietary instructions. Did they give you those? Okay, so that was a clear diet for the last 24 hours. Did you do that? And the cleansing enema yesterday or last evening. And nothing to eat or drink since last night. So, okay. All right. Have you ever had any surgery on your stomach or intestines? Have you recently had a colonoscopy with a biopsy in the last 7 days? No. Have you had any history of cancer on your stomach or intestines? No. Okay. And what are the current problems that you're having today?
For 2 months, I've been having cramping, diarrhea, and weight loss.
Okay, cramping, diarrhea, and weight loss for the last 2 months. Okay. What I'm going to have you do is put a gown on for me. You're going to take everything off, including your bra and underpants, any jewelry or piercings that you might have on your body. I can give you a pair of hospital socks. That way we don't have to worry about anything getting into your socks or shoes. So the gown closes in the back. Okay? Okay, so the radiologist and I are going to be doing this exam together. Okay. So have you ever had a barium enema before? No. Okay, let me explain a little bit about what we're going to do. There's this barium, and it's in this bag hanging here. And I have this tip, and I'm going to have you lay on your side and kind of bring your knees up a little bit. And then I'm going to very gently insert this tip into your rectum. It goes about 4 inches deep. The whole thing does not go in. And it won't fall out. It has a little balloon on it, and it won't fall out. I'm going to be there throughout the whole procedure, so if you feel like it's getting uncomfortable or you feel like it's falling out, you can say something and I'll be right there. The first thing we're going to do before we do any barium is I'm going to take a picture of your belly before I even go get the radiologist, so just so we can see it without the contrast. Then after I insert the enema tip, the radiologist will come in, and with this fluoro tube, we'll take pictures of you, like video pictures, in different positions. He'll ask you to roll around the table. I will be right there to help you get into the different positions to make sure everything is okay. The tubing on the tip is flexible, so it will move with you. And when I insert the tip, you will feel some uncomfortable pressure, but I'm going to be there to remind you to take nice, slow, and deep breaths. And we can control how fast the barium goes through the tubing into your colon. And so we can do this very slowly to avoid too much cramping or feeling like you're going to have to go to the bathroom. If you do have an accident during the exam, it's not a big deal. It happens to a lot of people. But most of the time, patients are able to kind of handle it because we try to move as slow as possible. Okay? Once the radiologist is done with his part, I'm going to put you in a couple different positions that he was not able to get with the fluoro tube, and just take regular x-ray pictures with the smaller x-ray tube with the tip in still. And then one of the last pictures I'm going to take, I'm going to lay you on your belly. I'm going to set my tube up, and then I'm going to quickly but safely remove the enema tip and then run back real quick to take the picture, and then you're going to be allowed to then go to the bathroom and expel the rest of the barium. Once you've done that, we'll come back to the table, we'll lay you on your back and take one more picture after you've gone to the bathroom. Do you have any questions? No. Okay. I'm going to go ahead and take your first picture and then go get the radiologist. Okay. I have a 16-year-old female who followed the dietary prep. I've taken the Scout and sent it to you. She is not pregnant. She does not have a history of surgery to her intestines or colon. She has not had a colonoscopy with biopsy in the last 7 days, and she does not have a personal history of cancer in her GI system. The current complaints are diarrhea and cramping for the last 2 months with weight loss, and she is gowned and ready in the room. Okay, now that we've done the whole exam and I've got you changed and ready to take you back out on your day, I just wanted to let you know that for the rest of the day you can go back to your typical diet of whatever you were eating before and increase your fluid intake, just a little extra today to help continue flushing that barium out of your system. Okay? Thank you for choosing Ohio Health. We